So when I think about building a health equity agenda for Canadians and for Canada as a country, I think what's really important is to think about agenda at the different levels of our country, because our country is so diverse and so big. So I want to think about both. We equate national often with federal, and I think there are components of the agenda that have to be federal, but there are components that have to be provincial, territorial. There are components that have to be local and community. And I think because of our Indigenous history in Canada, there are actually pieces that are related to First Nations governance. And I think it's really exciting to think about an agenda for Canadians, by Canadians, with Canadians, as opposed to a federal agenda. So when I think about what are the components of that and what are the actions that need to be part of that, I think we need to be paying attention to structural change. Those are the factors that really make a difference to creating inequities that affect health and that are experienced through health. And the strategies and the solutions need to be both about those huge structural pieces and about the more about the way that we experience health differences. And so if I kind of translate that, I think there's a huge piece that really is about how we structure society, the context and the stratification of society, to mean that some of us are healthy and some of us aren't. And the factor that's most instrumental to that is income, how much money we have to live our lives and to be healthy in all kinds of ways. And then factors that affect that, I would really say play out in terms of paying attention to shelter and where we live, and I often put housing and food a bit together. It's what are those daily conditions of daily life, and then I put together those pieces of employment and education. What gives you that ability to move forward in life and to sustain a quality of life through your work once you are educated. And then there's a whole piece that often gets lost. There's a piece of what I think of as our social interactions. For us to be a more equitable society, we need to know each other. We need to support each other. We need to be in our lives together, as it were. And so thinking about those factors helps move us away from an individualist frame to more of a collective or societal way of thinking about how we find solutions.